So what I've got here is a coronal CT image, presumably taken during the portal venous phase of contrast enhancement. As I take a closer look, there are a few key findings I want to walk you through. Starting with the liver itself, it's noticeably small in size and has an irregular contour, which immediately raises concerns for cirrhosis, likely macronodular given the appearance. Now, shifting my focus, I can see some free fluid around the liver and between some of the mesenteric folds. Free fluid in the abdomen, especially in a patient with cirrhosis, makes me think about ascites. Given the background of liver disease, this is not unexpected, but we need to ensure that we're not missing any signs of a more acute process, like bowel perforation or ischemia. Speaking of the bowel, the small bowel loops look abnormal. There's wall thickening in certain areas, and I can spot some patchy, interrupted mucosal enhancement in the proximal jejunal loops. This doesn't look good. These findings, especially in a cirrhotic patient, make me worried about ischemia or even infarction. I'm also noticing a couple of small foci of gas in this area, and while gas in the bowel wall isn't a definitive sign of perforation, it's enough to make me cautious. Looking more centrally, the mesentery is also abnormal. There's generalized haziness with prominent engorged vasa recta vessels, which makes me concerned about venous congestion. Now, the real kicker here is the filling defect I'm seeing in the portal vein. It's got this classic sausage-like appearance, and it extends into the superior mesenteric vein. This is most likely a thrombus, portal vein thrombosis. Now, with portal vein thrombosis, there's always a risk of bowel ischemia, especially if it extends into the mesenteric veins, as it seems to be here. We've already seen bowel wall thickening and mucosal enhancement changes, which are early signs of ischemia. However, there's no obvious pneumatosis, gas in the bowel wall, and I don't see any free intraperitoneal gas, so at this point I can't definitively call it a perforation. But, given the findings, bowel infarction remains a real possibility. Now, taking another step back to look at the broader picture. This patient likely has cirrhosis, as indicated by the small, irregular liver, the varices between the liver and stomach, and the free fluid in the abdomen. Cirrhotic patients are already at an increased risk for portal vein thrombosis because of their prothrombotic state. It's quite common in patients with advanced liver disease, and the liver itself, here, looks consistent with macronodular cirrhosis. So in summary, the most significant findings here are portal vein thrombosis with probable extension into the superior mesenteric vein, causing bowel ischemia. There are early signs of potential infarction, with thickened bowel walls and mucosal enhancement, but no definitive signs of perforation. Given the severity of the findings, I would immediately discuss this case with the surgical team. This is a surgical emergency. Bowel ischemia, especially in the setting of venous thrombosis, can quickly progress to infarction and perforation. They will likely need to go to the operating room to explore and potentially resect infarcted bowel, depending on the extent of the ischemia. And that's a wrap for this case. Thanks for sticking with me through this complex discussion of portal vein thrombosis and bowel ischemia. If you enjoyed this deep dive and want more radiology content, be sure to subscribe to Radiology Made Easy for more cases like this. Stay sharp and keep learning.